Hi, it's Fran, your holistic hygienist here at Dr. Gashinsky's Holistic Dental Center, and I'm here to talk to you about something that you may have had or may have been told you need, or you've had a family member who have had it, and that's called a deep cleaning. You say, well, deep cleaning, that sounds pretty like I don't want that, and actually it's not that bad. And I'm going to talk to you a little about what it is and why you need it first before we go into any other details. So first of all, what is a deep cleaning? Well, a deep cleaning is usually done with some local Novocaine. The reason being is because if your gums are very infected and they're very inflamed and you have some deep pockets where a lot of tartar and a lot of stuff is hanging out, there's really no way for us to get it at it comfortably without you being numb. And you're like, okay, pockets, what do you mean by pockets? I know deep pockets means you got lots of money, but I don't think that means in my mouth. So what I'm talking about in deep pockets is, we're going to say this for example is your tooth, all right? And this is your gum, and this is your cheek, or it's just your extended part of your gums. Now you can see my cuff is going to be your gums. Your gum doesn't stop right where you see it. There's actually a little bit of a space. That's the way it's supposed to be. And that tiny little space is very normal. And bacteria likes to hide in there. It's dark, it's warm, it's moist, they're nice and cozy. So if they're left alone for a long period of time, they start to grow down the root of the tooth, and it can cause an infection and cause the gum to detach, or the gum kind of come away from the tooth. So I'm going to give you an example. We use a little ruler, a tiny little ruler that fits in that space, kind of like what this ruler does. And then I can measure some spots. See, a couple of spots that are pretty healthy, the ruler doesn't go real low. There's a spot that's diseased, that ruler will go really low. And what happens is you can see that when I can pull away my jacket, so is your gum. So your gum is now not attached and the bone is deteriorated. So you can have a perfectly healthy tooth, but if there's no bone and gum holding it, doesn't matter how healthy this is, the supporting structures are not healthy. So when you have deep pockets, they need to be cleaned out. So we get your gum, they clean it out, and then they do the other side. Usually most conventional offices will do one side, then have you back next week to do the other side, top and bottom, and then they'll see you in 3 months. Okay, the issue with that is you're getting the cleaning done, but is it really addressing the root cause of the problem? If all that bacteria and stuff is left in there, with a conventional cleaning, they go in with an instrument, we'll say this spoon handle, they go in and they start just pulling out all that stuff that's in the pocket. There's no cutting or anything involved, which is fabulous. But are they really getting all what's causing the disease? So that's the difference between a conventional and a holistic, and I'll talk to you about that in maybe the next video. But the question is, what happens if we just leave it alone? Nothing doesn't really bother me. I don't feel anything. Well, what about, do you ever have like a really bad taste in your mouth? Do your gums bleed when you brush them? Even when you eat? Do you find that maybe there's blood on your pillow when you wake up in the morning? Do you find that your teeth are starting to get a little wiggly? Teeth are supposed to be nice and firm in your jaw, and if they start moving around, or even yet, teeth are starting to flare out. Instead of them being nice and straight, they're starting to come out a little bit more. This means that the supporting structures of your teeth are being lost. Bad taste is the bacteria. The bleeding is being caused by the bacteria. The movement is being caused by the bacteria eating away at the bone. So just by removing the tartar and cleaning out those pockets isn't really addressing the cause of the disease. It's treating the disease. So what I want you to do is I want you to tune in to the next video, and we're going to talk about how a holistic deep cleaning really is going to benefit you more than just a conventional cleaning. We'll help you this much. We want to help you this much. All right. So I want you to make sure that you subscribe to our channel, and I want you to ask some questions below. Ask me exactly what I'm talking about, and I'll be happy to answer your questions. So make sure you tune in for more tips, tricks, and info, and wait for the next one.